I'm Dr. Taylor Strange. I'm a cataract refractive surgeon in the Dallas-Fort Worth Metroplex. And I started with LAL in 2021. I bought my first LDD machine. And it took me about 3 months to pay it off with the volume of LALs I was doing. Happy to announce that now I have 3 LDD machines. Even as a solo surgeon, I need 3 because my volume is so high. Doing 20 LALs a week, I'm able to pay off the 2 new LDD machines within a month. So I'm very impressed with the technology and the outcomes that it delivers.
Hi, my name is John Josephson. I'm in Northern Virginia. We purchased our LDD device about 1.5 years ago. No regrets at all. Probably paid it off within about 3 months, maybe even sooner. If that's your apprehension, I'll lease one to you, but you'll kick yourself for it later.
Hello, my name is Dr. Bill Sosha. I'm medical director for the Florida division of USI, based out of Sarasota, Florida. So here to talk a little bit about ROI, return on investment. And I think all of us as physicians, regardless of how business oriented we are or are not, how we have to think of the bottom line. Number one, we have to say, is this technology going to be good for our patients? Do we have room for this? Do we need this technology? That question answered 100%. The ability to be able to have a technology where we get such wonderful vision that we can adjust and fine tune to how patients like it, no brainer. What has that done to us in terms of return on investment? For me personally, I've looked at all my numbers before coming to this very talk today and found that I increased my conversion of people to advanced technology lenses by 10%. And that's a very conservative number. I actually think it's a little more than that if I dig back even further. And so what does that mean? Well, that means a lot. I do over 2,000 cataract cases a year. So you're looking at, that's almost another 200 patients that we're converting from probably doing a regular monofocal lens because they either A, weren't a good candidate for a multi-technology for an objective or subjective reason, that now we can give them that technology. So you can do the math and see, based on how you're charging for these upgraded technologies, that that's alone. And I have 4 other doctors in my practice who also use the technology. So when you extrapolate that, even though our numbers are a little bit different, they're pretty close. So do the math. Most of the LAL people will tell you very conservatively what it will take in terms of the purchasing of the LDD machine, the staff, the necessary equipment, other things that are necessary to do the adjustments, and usually tell you that the technology will pay itself off in months. We had it paid off in, I think, less than a month. So, an amazing in terms of patient results, which is first and foremost, amazing for our return on investment.
Regarding return on investment with the RxSight LAL, that was a chief concern for me as a sole practitioner in terms of ownership. I am entirely responsible for making payroll. I do have partners that I work with, but at the end of the day, if we come up short, they don't have to worry about it, but I do. So buying new equipment or introducing a new product line is always a tense decision. And in talking with other doctors who've wanted to get started with RxSight LAL, that also has been their primary concern. In our experience, and we live in a fairly small market where the demographic is such that disposable income is definitely an issue for a large number of our patients, our return on investment was still only 9 months. And I was very pleasantly surprised because generally, if I'm considering a capital expense, I'd like to know that that's going to pay for itself in somewhere between 1 and 5 years. So 9 months, we beat our own expectations, and that made me very happy. The differential between LALs and multifocal lenses is not so much in our market, and I know that in other markets, it may be more, right? So if you practice in a larger area or a larger demographic with a higher price point, your return on investment is likely to be substantially shorter than that. The question always comes up about the time in the practice and practice management separate from the expense of the actual equipment, and we've been able to manage that very well. I don't feel like we've increased practice expense in terms of chair time with the patient pre-op and post-op relative to what we were already doing with multifocals. And the percentage uptake in premium lenses, including RxSight, has definitely gone up substantially. There's been a very significant shift in the number of multifocals going down and LALs going up. So in summary, a return on investment on the machine and the investment was about 9 months, just over for us in a relatively modest market. And chair time has not gone up substantially with some careful training and attention to detail. And I'm totally thrilled with the results. The return on investment in terms of personal, professional satisfaction is off the charts.
I'm James Murphy. I am a refractive cataract and glaucoma specialist practicing at Scarsdale Ophthalmology Associates in Scarsdale, New York. Just here talking about the ROI considerations for purchasing of a light delivery device and incorporation of LAL into our practice. So from inception, it took us about 7 to 9 months to earn back the cost of the light delivery device. And that was based off of really just a few LALs every week based on how we priced it, which was the highest premium intraocular lens implant that we offered as part of our package. It's been amazing. The workflow is seamless now after 2 years of doing light adjustable lens, so it has no impact or dent on our clinical workflow in the office otherwise. So it's just a huge value add and really expanded the patient population for which we can offer advanced technology IOLs. So it's been amazing.
Hi, my name is Barry Lee. I'm a cornea, cataract, refractive surgeon in Atlanta, Georgia at Eye Consultants of Atlanta. And just want to give you a little bit of a take on my experience and my journey with a light adjustable lens. I was very hesitant to purchase the technology. Initially, it's a big capital expense up front. And obviously, I think that's a concern for a lot of surgeons across the country. After talking to a lot of the experts across the country that I really trust and believe in their opinions and advice, I really felt 2 years ago that it was worth our practice expense to pursue this technology, and really haven't looked back in doing this. The expense went away very quickly. 3 or 4 months, we were able to recoup the cost of the technology just because of the overwhelming adaptation of our patients with the lens. I would encourage you, if you're not using this technology now, if you're a little bit nervous about doing it, do the research like I did. Look into this, talk to your friends and experts across the country that are using this technology, and I think you'll be really happy to make the investment. And more importantly, I think your patients will be really happy that you made that investment, and that's the most important thing.
I'm Carlton Fenzel from Eye Surgeons Associates in Bettendorf, Iowa, and I was asked to talk about the ROI for the light adjustable lens. And so for us, our first year, we started off a little bit slow, and we were doing certain types of patients, being more particular, and we were able to actually pay off the machine that first year. And then the next couple of years, we've had it for 3, we were actually able to add another 6 figures on year after year.
My name is Jay Singleton. I'm an ophthalmologist in New Bern, North Carolina. We've been using the light adjustable lens for about 2 years now. We've had excellent results. Many times people kind of are afraid of this technology because the machine we use to adjust the eyes after surgery is expensive. But I will assure you, we paid ours off in about 6 months. And we're so confident that we can pay it off again that we're actually looking to get another device for a separate location.
I'm Dr. Kipper Nelson, Chief of Cataract and Lens Implant at Southern Eye Center in Hattiesburg, Mississippi. And I'm pleased to talk to you today about the light adjustable lens and just what it's meant to my practice at Southern Eye Center. So I've had a lot of people talk to me about, I like the technology, I see the benefit of it, but I really don't know about the investment in the LDD during these uncertain economic times. And I can just speak from my personal experience. We bought an LDD and placed it into our main surgery center. Within 6 months, we had received a complete return on our investment. And then, at that point, I was like, well, I'd kind of be crazy not to buy one and put it in our other surgery center. So we did that. And that other surgery center is not quite as busy as the first one, but within a year, we had the second device paid off. Both of those were in my acceptable range for ROI, and so I couldn't be happier with my investment in the light adjustable lens technology and how it's allowed me to grow my refractive cataract practice.
Hello, my name is Dr. James Dean. I'm an ophthalmologist from Putnam, Connecticut. I've been using the light adjustable lens for approximately 2 years now. I've done just about 400 cases. Payoff time was about 7 to 8 months. Wouldn't change a thing.
Hello, I'm Clay Bundrick from Shreveport, Louisiana, and I'm here with RxSight talking about light adjustable lens, which we started using about a year and a half ago, and it's been a big win for our practice. Originally, we were concerned about the economic investment, but it turns out that that took care of itself in just a few months because it's really expanded the number of patients we can offer a premium option to. So LAL has been a big win for Highland Eye Clinic in Shreveport.
I'm Dr. Jason Brenner and I work with Boston Vision, so it's nice to be here at ASCRS from my hometown. When you're adopting LAL technology, there's always a question of the cost of the machine and the cost of the lens and whether you're going to be able to return on that investment. And for me, I feel that LAL expanded my premium practice. It did not take away from the other lenses I was doing, because sometimes there's different patients that want this kind of technology. So for us, it didn't take long for us to get a good return on our investment and to pay off the machine.
My name is Dr. Daniel Schwartz. I'm at Boston Eye Physicians and Surgeons in Brookline, Massachusetts. The light adjustable lens has been a game changer for my practice. My premium percentage has gone way up, my patient satisfaction has gone way up, and my referrals have gone way up because my patients are so satisfied. And this has all translated into record revenue growth for my company and the happiest patients I've ever had. So I'm very excited to use this technology. It's been a game changer for my patients and my practice.
I'm Dr. Scott Laborwood in the Baltimore, Maryland area, and I'm the chair of the Medical Advisory Board with Vision Innovation Partners. We had an interesting dynamic, and that's how I started using the light adjustable lens, because the business side and the provider side of our platform of over 150 doctors in 11 surgical centers and over 50 practices really work well together, and we can use a synergy to give the best health care for our patients. So RxSight really helped us by having technology that we could offer to our patients. So it was really the business side that came and said, hey, look at this technology. And we had 4 providers in 4 different locations adopt this technology, but we had full support in the clinic from the provider side and the business side, so our patients could have access to this technology and the best patient experience possible. The interesting thing is the 4 providers quickly started talking about how it's not just a patient experience, it's a provider experience as well, because it really changes the dynamic and the intensity of the conversation, because they're not just defending the choice they made of picking one lens off the shelf for the rest of the doctor and patient's life. They can put a lens in the eye and then take their most difficult patients and transform them into the easiest patients. And so it's that energy that then allowed us to then do 2 more sites, and then we have 2 more sites that are interested as well. So having this technology allows us to offer something to our patients in the platform to allow us to continue to be a best-in-care facility and then partnering with RxSight along the way.